Most people spend years worrying about the obvious threats to their heart. They watch their cholesterol. They cut sugar. They swallow pills every morning with a glass of water and hope their next doctor's visit brings good news. But there is one habit happening every single night that almost nobody talks about, and after the age of 60, it may quietly influence your heart more than you realize. It happens while you are unconscious. No treadmill, no expensive supplements, no strict diet. Just the position your body falls into for 7 or 8 hours every night. And what I am about to explain could completely change the way you sleep starting tonight. For decades, most doctors treated sleep position as nothing more than a comfort preference. Some people like sleeping on their back, others curled up on one side. It was never considered a serious medical discussion. Heart disease was blamed on food smoking, stress, weight gain, and inactivity. Sleep itself was rarely examined deeply enough. But modern research has forced medicine to rethink that assumption. Because your body does not shut off when you sleep. In many ways, your cardiovascular system becomes even more active during the night. Your blood pressure changes hour by hour. Your heart rhythm shifts. Hormones rise and fall. Blood circulation behaves differently depending on gravity and body alignment. And once you pass 60, those differences become far more important. I have spent more than 3 decades working around damaged hearts. I have seen arteries blocked after years of silent inflammation. I have watched patients survive bypass surgery, only to discover that the small habits repeated every day were what slowly pushed their heart toward failure in the first place. That is what changed my perspective. Not the dramatic emergencies, the quiet damage, the tiny daily stresses repeated thousands of times over decades, and there may be no habit repeated more consistently than the way you sleep. Think about it. Nearly 1/3 of your entire life is spent lying down. Over the course of a year, that becomes thousands of hours. Over a decade, tens of thousands. Yet almost nobody stops to ask a simple question. What position gives the heart the least amount of strain during all those hours? The answer begins with basic anatomy. Your heart is not perfectly centered inside your chest. Most people imagine it sitting directly in the middle, but that is not true. Nearly 2/3 of the heart rests slightly toward the left side of the body. That detail matters more than people think. When you sleep on your left side, gravity naturally assists the heart's pumping action. Blood flow becomes smoother and more efficient. The heart does not fight against pressure in the same way it can during other sleep positions. Imagine carrying a heavy bag downhill instead of uphill. Same level and effort. Now multiply that tiny reduction in effort across nearly 100,000 heartbeats every single day. Over years, that mechanical advantage becomes meaningful, especially after 60, because aging changes the heart in ways most people never notice at first. The heart muscle gradually stiffens. Blood vessels lose elasticity. Circulation becomes slightly less efficient year after year. Even healthy adults experience these shifts naturally with age. That means anything reducing unnecessary strain becomes valuable. Now, this does not mean sleeping on your left side magically transforms your heart into that of a healthy 25-year-old. It is not a miracle cure. But the body heals through small advantages accumulated consistently over time. And this is one of those advantages. What surprises many people is how rarely this conversation happens inside medical offices. Patients are taught about sodium intake, cholesterol levels, and exercise routines. But almost nobody discusses the 8 hours every night when the cardiovascular system is actively recovering. Yet those hours may determine far more than we once believed. And there is another reason left-side sleeping matters, one that involves a hidden blood vessel running deep inside your body. Most people have never heard of it, but this single vein quietly controls how efficiently blood returns to your heart every second of your life. And when that blood flow becomes restricted night after night, year after year, the consequences slowly begin to build beneath the surface. There is a massive blood vessel inside your body working every second to keep you alive. Yet most people have never heard its name. It is called the inferior vena cava. And after the age of 60, the way you sleep may directly affect how well it functions through the night. This vein is one of the most important highways in your entire circulatory system. Its job is simple but absolutely critically. It carries blood from the lower half of your body back to your heart. Blood from your legs, pelvis, abdomen, and lower organs all travels upward through this single pathway. Every heartbeat depends on that return flow, because the heart cannot pump blood out efficiently unless blood first returns back in. Here is where things become fascinating. The inferior vena cava runs slightly along the right side of your spine. That detail changes everything. When you spend hours sleeping on your right side, the weight of surrounding organs can place additional pressure on this vein. Not enough to completely block circulation, but enough to slow the smooth return of blood toward the heart. And when blood return slows, the heart must work harder to maintain stable circulation. Most people never feel this happening. There is no dramatic pain, no obvious warning sign. Night after night, your cardiovascular system responds to tiny changes in pressure and flow. Over years, those small adjustments accumulate in ways most people never recognize until problems appear later in life. Now compare that to left side sleeping. When you rest on your left side, pressure is taken away from that major vein. Blood moves more freely back toward the heart. Circulation becomes steadier. The workload placed on the cardiovascular system decreases slightly but consistently. And after 60, slightly. Matters more than ever. Because aging naturally changes the veins themselves. The walls of veins become less elastic over time. The tiny valves helping blood travel upward against gravity begin weakening. Blood flow can slow more easily than it did decades earlier. That is one reason swelling in the legs becomes more common with age. It is also why circulation deserves far more attention than most people give it. You may think of circulation only when discussing exercise, but circulation continues all night long while you sleep. Your body never stops managing pressure, oxygen delivery, and blood return. Every sleeping position changes those dynamics. And there is another concern connected directly to slow circulation. Blood clots. In my years working around cardiac patients, some of the most devastating cases were the ones nobody expected. Patients who seemed stable. Patients who went to sleep feeling normal. Patients with no dramatic symptoms beforehand. Then suddenly, everything changed. Blood clots are dangerous because they often develop silently. One major cause is something called stasis. Blood moving too slowly through the veins. Most people associate clot risk with long airplane flights or hospital stays. But blood pooling can also happen during long hours of poor circulation at night, especially in adults over 60. As we age, blood flow naturally slows. Dehydration becomes more common. Some medications slightly alter blood thickness and circulation patterns. Vein walls lose flexibility. All these factors combine quietly beneath the surface. Now imagine spending 8 straight hours in a position that allows blood to move less efficiently. Night after night, year after year, that is why sleep position suddenly becomes more important than many people realize. When you sleep on your left side, circulation through the deep veins tends to remain smoother and less restricted. Blood keeps moving instead of pooling as easily. And moving blood is healthier blood. Because stagnant blood is where problems begin. Does this mean left side sleeping guarantees protection from clots? No, medicine never works in absolutes. Clot formation depends on many different factors including genetics, medications, mobility, hydration, and underlying disease. But improving circulation during 1/3 of your life is still a meaningful advantage, especially when it costs nothing. That is what makes this so remarkable. No surgery, no expensive treatment, no prescription. Just changing the direction your body faces while you sleep. But circulation is only part of the story. Because something even more surprising happens during sleep, something involving your brain itself. Scientists once believed the brain had no dedicated cleaning system. For decades, nobody understood how the brain removed waste created during the day. Then researchers discovered an astonishing process that activates while you sleep. A hidden nighttime cleaning network. One that may influence memory decline, inflammation, stroke risk, and even diseases like Alzheimer's. And according to growing research, the position you sleep in may directly affect how well that system works. While you sleep tonight, your brain will begin cleaning itself. Not metaphorically, literally. And the position you sleep in may determine how efficiently that cleaning process happens. For decades, scientists struggled to answer a basic question. How does the brain remove waste? Every organ in the body has systems designed to clear toxins and debris. The liver filters chemicals. The kidneys clean the blood. The lymphatic system removes waste from tissues throughout the body. But the brain seemed different. Researchers could not fully explain how billions of active brain cells cleared away the metabolic waste created every day from thinking, reacting, remembering, stressing, and simply staying alive. Then modern imaging revealed something extraordinary. The brain has its own cleanup network, a specialized drainage system that becomes highly active during sleep. Scientists now call it the glymphatic system. Think of it as your brain's overnight sanitation crew. While you rest, cerebrospinal fluid begins moving through microscopic channels in the brain, washing away proteins, toxins, inflammatory compounds, and cellular waste that accumulated during the day. And this process matters far more than most people realize, because one of the substances cleared during this nighttime cleaning process is amyloid beta, a protein strongly linked to Alzheimer's disease and cognitive decline. Another is tau protein, which researchers frequently find in brains affected by neurodegenerative disease. In simple terms, your brain spends the night trying to protect itself from long-term damage. But here is where things become especially important. Research suggests this system works more effectively when you sleep on your side. And among side sleeping positions, left side sleeping may provide the greatest advantage based on the brain's natural drainage pathways. That finding surprised even many doctors, because suddenly, sleep position was no longer just about comfort or circulation. Now it was connected to brain health itself. And after 60, the brain and heart become deeply connected in ways most people underestimate. People often separate cognitive decline from cardiovascular disease as if they are completely different problems. But they are not. They are closely tied together through the same network of blood vessels, inflammation, and oxygen delivery. What harms the blood vessels of the heart often harms the blood vessels of the brain too. That is why stroke risk rises alongside heart disease. That is why vascular inflammation matters so much. That is why protecting circulation during sleep becomes increasingly valuable with age. Because every night, your body enters a critical maintenance period. Your heart attempts to recover from the day's stress. Your arteries relax, hormones reset, and your brain begins clearing away harmful waste before it can accumulate further. But the body can only perform those tasks efficiently under the right conditions. And sleep position appears to be one of those conditions. What makes this even more fascinating is timing. The glymphatic system becomes most active during deep sleep, especially between roughly 11 p.m. and 3 a.m. During these hours, the brain increases fluid movement dramatically, almost like opening floodgates for overnight cleaning and repair. But if sleep quality is poor, if breathing is interrupted, if circulation is compromised, or if the body remains under subtle stress throughout the night, that recovery process becomes less efficient. Over months and years, those lost hours of recovery begin adding up. That is the part many people miss about aging. The body rarely breaks down all at once. Damage accumulates quietly. A little inflammation here, slightly reduced circulation there. Tiny increases in stress hormones night after night. Small inefficiencies repeated for decades. Eventually, the system begins struggling to keep up. And this brings us to another problem affecting millions of adults over 60. One that many dismiss as merely annoying, but which may directly influence heart rhythm itself. Acid reflux. Most people think reflux is only a digestive issue, a burning sensation after dinner, a sour taste during the night, something uncomfortable but harmless. But chronic nighttime reflux creates inflammation in the esophagus, and that inflammation can affect a nerve running directly beside it, the vagus nerve. This nerve plays a major role in regulating heart rhythm. When irritation becomes chronic, the risk of rhythm disturbances increases. Researchers have found associations between severe reflux and conditions like atrial fibrillation, one of the leading causes of stroke in older adults. Now here is the important part. Body position dramatically changes reflux severity. Your stomach naturally sits more toward the left side of your body. When you sleep on your left side, gravity helps keep stomach acid lower, preventing it from rising into the esophagus as easily. But when you sleep on your right side or flat on your back, acid can travel upward much more easily during the night. More reflux, more irritation, more inflammation, potentially more strain on heart rhythm over time. Again, none of this happens dramatically overnight. That is what makes it dangerous. It happens slowly, quietly, repeatedly, exactly the way many cardiovascular problems develop. And there is one more hidden process happening during sleep that may be even more important than all the others combined. Your blood pressure is supposed to fall naturally during the night. But for millions of people over 60, it never does. And when that protective nighttime drop disappears, the risk of heart attack and stroke rises dramatically. There is something your heart is supposed to do every single night. Slow down, relax, recover. In healthy adults, blood pressure naturally drops during sleep by roughly 10 to 20%. Cardiologists call this nocturnal dipping. It is one of the body's most important recovery mechanisms. During those overnight hours, your arteries finally get relief from the constant pressure of daytime circulation. Stress hormones decline. The heart pumps with less force. Blood vessels repair microscopic damage caused by years of wear and tear. This nightly recovery window is essential for long-term cardiovascular health. But here is the problem. Millions of adults over 60 never experience this healthy drop at all. Their blood pressure stays elevated throughout the night without them realizing it. Doctors call these patients non-dippers. And the research surrounding non-dipping is deeply concerning. People whose blood pressure remains high during sleep have significantly greater risks of stroke, heart attack, kidney damage, memory decline, and heart failure later in life. In many cases, nighttime blood pressure becomes an even stronger predictor of future cardiovascular events than daytime readings taken at the doctor's office. That means someone can appear relatively stable during the day, while their cardiovascular system remains under constant strain every single night. And most never know it is happening. Why? Because nighttime blood pressure problems are silent. There are no obvious warning signs, no alarm bells, no dramatic symptoms. Just quiet stress placed on the heart hour after hour while the body is supposed to be recovering. Now here is where sleep position becomes surprisingly important. When circulation is restricted or breathing becomes unstable during sleep, the body's stress response partially activates. Adrenaline and cortisol remain slightly elevated. The nervous system stays more alert than it should. As a result, blood pressure fails to dip properly. This is especially common in adults with sleep apnea, poor circulation, chronic inflammation, or disrupted breathing patterns. And body position directly affects many of those factors. Left side sleeping helps circulation remain smoother throughout the night. It may also reduce certain breathing interruptions associated with positional sleep apnea. Fewer breathing disruptions mean fewer sudden spikes in stress hormones and blood pressure while sleeping. In other words, the body can finally enter the recovery state it was designed to reach. That matters enormously after 60. Because aging hearts need recovery more than younger hearts do. After decades of constant work, the cardiovascular system becomes less resilient. Arteries stiffen. The heart muscle loses flexibility. Recovery from daily stress takes longer than it once did. That is why nighttime recovery becomes so valuable. Your body is trying to repair itself while you sleep. The question is whether you are helping that process or quietly making it harder. And this is what I want people to truly understand. Preventive medicine is rarely about one dramatic action. It is about small advantages repeated consistently. A healthier meal repeated over years. A daily walk repeated over decades. Better sleep repeated every night. These things seem minor individually, but together, they shape the future of the heart more than most people realize. That is exactly why left-side sleeping deserves attention. Not because it is magical, not because it guarantees perfect health, but because it supports several important systems simultaneously. Better circulation, reduced pressure on major veins, improved nighttime recovery, less acid reflux, potentially more stable heart rhythm, better support for the brain's cleaning system, and healthier blood pressure regulation during sleep. All from one simple adjustment. No prescription, no expensive device, no monthly subscription. Just a different sleeping position. Now, if you are not naturally a left-side sleeper, do not worry. Most people need a little time to adapt. The body likes familiar patterns, especially during sleep. But small adjustments make the transition easier. Place a pillow firmly behind your back to prevent rolling over unconsciously during the night. Put another pillow between your knees to keep the hips aligned and reduce pressure on the lower spine. These tiny changes often make side sleeping far more comfortable within days. Usually, after 1 week, the position begins feeling more natural. After 1 month, many people stop thinking about it entirely. The body adapts quickly when comfort and consistency come together. And honestly, that may be the most remarkable part of all this. Something so simple may quietly support your heart every single night for the rest of your life. That is powerful. Now I want to leave you with one final thought. Your heart has been working nonstop since the day you were born. Every minute, every hour, every year, it has carried you through stress, loss, hard work, fear, happiness, illness, and recovery without ever taking a single day off. And after 60, the goal is no longer just survival. The goal is reducing unnecessary strain wherever possible, so the heart can keep serving you well for years to come. Tonight, when you lie down, remember this: your sleeping position is not just about comfort anymore. It may be one of the easiest forms of heart support available to you. If this video helped you